Hi, I'm Dr. Dave Novatnak of Doctors Choice Physical Medicine Rehab in Pottsville, Pennsylvania. And today we're going to talk about the symptoms and causes of carpal tunnel. This is the normal anatomy of the wrist. This is the median nerve. This is the nerve that causes carpal tunnel when it's trapped right in the carpal tunnel, right here. This is the transverse carpal ligament. And these are the muscle tendons that go up into your fingers that enable you to flex your fingers. The darker blue here are the tendon sheets. In this picture, we're looking at a cross section of the hand. Just imagine taking a cut right across your hand. And this is what we're going to display. Here we see the median nerve and the 9 muscle tendons that go through the carpal tunnel. These are the bones that make up the wrist, and this is the ligament. In this picture, again, this is the median nerve, and you can see a true carpal tunnel is going to affect the thumb, the pointer finger, the middle finger, and the inside of the ring finger. One of the symptomatic areas or symptoms caused by carpal tunnel is numbness. Additional sensory symptoms of carpal tunnel include hand and arm fatigue, of course pain, tingling, cramping, coldness, and burning. These are all symptoms that my patients tell me they've experienced. And of course, the most common one is tingling. There are also what we call muscle symptoms or motor symptoms of carpal tunnel, because the nerve not only affects the feelings in your hand, it also affects the energy going to the muscles. This is the most common muscle that's affected. It's called the thenar muscle in the thumb. This becomes very weak. Therefore, you end up with loss of grip, loss of dexterity, and stiffness. Next, we'd like to talk about the causes of carpal tunnel. There are occupational causes, non-occupational causes, and unknowns. The most recent research suggests that carpal tunnel is actually a slow degenerative process that comes on over years. It's the occupational and non-occupational causes that seem to push it over the edge that finally causes the symptoms. One of the most important things about this slide is that the Mayo Clinic states carpal tunnel syndrome is very rare. Out of all the wrist problems they see, only 1 in about 1,000 is carpal tunnel. But carpal tunnel is one of the most commonly reported workplace injury. Those two facts just don't go together. So we have come to a conclusion that carpal tunnel is a syndrome that is a catch-all diagnosis. Experts have predicted that 40 to 50% of carpal tunnel diagnoses are inaccurate or incomplete. So let's review the occupational factors. One of the most common that we hear about are our ergonomic stresses. They come from repetitive activity, excessive use of force, exposure to vibration, exposure to cold, static positions, and again, workstation design faults. But what most people don't know about, there are psychosocial aspects of carpal tunnel also. Lack of control over the workplace, boredom at their job, unclear roles at their job dissatisfaction, and lack of social support either at home or at work. Non-occupational factors are very important, and these are some of the most common things that I see in my office. The most common ones I have highlighted in yellow. But carpal tunnel can be caused by systemic diseases such as alcoholism, diabetes, and gout. Oftentimes, with people with slow thyroid will have carpal tunnel problems. When we do a blood analysis on some stubborn carpal tunnel cases, we also see that there's a nutritional component. It may be that their diet is very poor or they have poor absorption. People with arthritis, such as rheumatoid arthritis, often have carpal tunnel type symptoms, and drugs also produce carpal tunnel problems. One of the most interesting cases I've seen was a lady that I treated 3 times a week for about 2 weeks, and every time we treated her, she improved, but each day that she came back, she was back to square one. On questioning further if there's any change in her medications, there was. She changed her high blood pressure medication about 2 weeks before her carpal tunnel problems started. We got in contact with her family doc, and he changed her back to the original high blood pressure medication that she was on, and the carpal tunnel symptoms went away. There's also effects from congenital defects. There's defects in wrist at birth. There's trauma at wrist. Oral contraceptives are pretty well known to be causing carpal tunnel problems because women who are on them retain fluid, and also women going through menopause have more carpal tunnel problems. Another interesting thing is that Caucasians have carpal tunnel at a much higher frequency than the rest of the population. This is followed by Hispanics and then by blacks or Afro-Americans, and the least people with carpal tunnel problems are Asians. These are the activities of daily living that are most affected. The ones that are highlighted in yellow are the ones that our patients tell us most about, period. For instance, people have problems getting dressed, particularly using buttons on their shirt. They also complain of driving the car. As they drive the car, their hands go numb, or in cases of very bad carpal tunnel, they even have a hard time turning the steering wheel. Computer work is very obvious. As they're working on the computer, they start to lose control of their fingers and it starts to hurt and their hands go numb. This is one you don't hear much about, is that reading or holding the paper or turning the pages of the paper, because the fingers go numb. It's hard to do fine manipulation. And lastly, this big one, sleeping. Almost everybody that I talk to has problems sleeping at night. They say the pain gets that bad, it wakes them up at night and they have to shake their hands. This is a normal cross-section of the wrist. Just imagine that we took a meat cleaver and cut right through your wrist here. These are the bones of the wrist, and I represented those bones right up here. This is the carpal tunnel, and this is the transverse ligament. In my drawing, these are the muscle tendons that go through the carpal tunnel. This is the median nerve, or the nerve that gets pinched, and this is the ligament. One of the toughest cases to treat is a person with square wrist. That means their wrists are as thick as they are wide. These people have a very deep and narrow carpal tunnel, and it appears to crowd out that median nerve and puts pressure on it. This is hard to treat just because of the architecture of the person. Some carpal tunnel is caused by a slight dislocation of the bone or a bone spur. In this picture, this bone is out of position compared to the rest of them, and it starts to narrow the carpal tunnel down, again putting pressure upon the wrist. This bone has to be adjusted or therapy done on it to get it back into place. Another fairly common problem we see are thickened, shortened ligaments. In this case, the transverse carpal ligament gets very thick. As it thickens, it crowds out the muscle tendons and again puts pressure upon the nerve. In this case, we have to stretch out this shortened ligament. This is one of the most common problems that we see. Another problem of carpal tunnel is a stretched out ligament. It gets stretched out like an old rubber band. And when that happens, the carpal tunnel gets very shallow and stretched out. And again, there's less room and the muscle tendons crowd out the median nerve. People like this typically have wrists that crack often because their wrists are very loose. Another very common problem that we see is thickening of the muscle tendons. In this case, these are the muscle tendons and they get very thick and swollen. When they thicken up, they crowd out the median nerve and puts pressure onto it again, causing carpal tunnel. So some of the causes of the tendon getting thick is coming from mechanical loading. Now, if you could take your grip and just squeeze it as hard as you can, we can get a number of what you can squeeze. Let's say it might be 35 pounds. If you have a job that is less than 30% of your maximum contraction, you can work that job all day and not have a problem with carpal tunnel causing those tendons to swell. But if you have a job that goes above 30% of that value, without sufficient recovery time, you start to get recruitment of other muscles because those muscles just go into fatigue, they swell and get pretty big. Another cause of the is a pro-inflammatory state. And this, again, may be caused by diet and inflammation. And as I stated earlier, meds would be another problem that causes the muscle tendons and ligaments to thicken. We also have additional carpal tunnel videos for you to watch. And you can check our website for a video on examination and test for carpal tunnel, conservative treatment for carpal tunnel, and carpal tunnel self-treatment stretches. Thank you for watching.